Daniel? Daniel.
In the pocket upstairs.
I'm just going to ask, how much is it? Where are we going? And where staying?
We're going to Baja, and it's, I believe, $99. That covers all your meals and everything, and they take you to some pretty posh places to eat down there.
I bet there's like 3 or 4 of these a
They
year.
said to me,
Yes.
but I need to
Yes,
switch
this
it up
is the
because
last
it's
one
bad.
for this school year. I mean, this new school year. Yes. Emily, did you have a question?
So, is there another one during summer?
I don't know. I don't know what's planned. I don't plan them. Sims plans them.
Okay. And then what's the safety like?
I've gone in there multiple times every year, and we're very, very safe. Sims won't go if it's not safe.
Okay.
That's that.
What are we allowed to do as juniors?
Juniors? Scaling? Oh,
What do we do just
yeah, I'm going to give it to you and make you work. Huh? No, go ahead and do it if you can do it back there. Just don't do it together. Or at your seat, whatever. Yes, anyone else? Question? In regards to clinical experience? Good? Okay, so this week we're pretty much going to hit it good with morning and afternoon clinics. So what I want to encourage you to do is if you are not, if you have both clinics back to back, are any of you back to back clinics this week? No, so be sure that you are bringing a lunch if you are, or you're seeing double patients, or even if you're on morning and afternoon but don't have a patient, because you know how late it is, finish up and get back and set up again and you go. Okay. Any questions on my new announcements that are posted? Okay. I write them in big detail. I don't mean for them to be laborious to read, but so that you understand what it is, and I hope it's clear. And it's not, stop me and let me know. Okay.
Okay.
About ready to give that up?
This out after.
Okay. Is something wrong with that?
This one. I'm going to switch it out.
Oh, okay. Thank you. So this morning, I'd like to introduce to you Dr. Eileen Kim. She works in the Division of General Dentistry Department. She's been here for several years. She'll tell you a little bit about herself. She has an interesting path to dentistry. But anyways, this makes her perfect for giving you this particular lecture about drugs and medications. She will be helping you to be able to find the medications that you see your patients taking and you don't know what it is. She has a lecture on how to find that, where to look it up, and how to soak them up. So you'll be needing to soak up medications. So I'm going to take my stuff and get out of your way, and it's yours.
Good morning, everyone. How are you? Can you hear me okay? Yeah? Okay. Nice to meet you all. I'm Dr. Kim. My Korean name is Soyeon, but I go by Eileen so that people can remember me better.
Do you need it louder?
Maybe a little bit.
Louder. Okay. Or can you talk louder? Maybe make it louder. The next. And you need to talk
Okay. Okay, so I'm going to talk about how to do medication soap, and then I'm going to touch how to do oral pathology soap today. A little bit of my background. I graduated in 2010 here from dental school, but before that, I grew up in Korea. And I actually went to pharmacy school in Korea, so I worked as a pharmacist for 2 years. But pharmacist job was good, but it didn't really fit for me. So I had my uncle here around PUC area, so I came to visit him, and then I met some friends, and then they recommended me, oh, why don't you try dentistry? So I changed my career. So I went to PUC in 2004. I did prerequisite course for dental school for 2 years, and then I came to Loma Linda 2006. And then after I graduated in 2010, I started part-time October. And then the following year, 2011, luckily they had some full-time position, so I became full-time position. So I'm here since basically 2006. I never left school. Maybe I took a couple months break after graduation, but I'm here. So medication soap, I know that you are taking pharmacology right now, or you're already, yeah. So that's really good time to talk about medication soap, and it's related to my background too. This is my colleagues. Maybe you know Dr. Jo. Yeah, so she's closely working with your department, and this is my colleagues. I work with them, and one of the reasons I like this school is my wonderful colleagues. This is the picture when I was D1. So it's 2006, and yeah, the type of work. We didn't have Nobel lab at the time, so we used to go to the old lab. Yeah, it was a long time ago, but time really went fast. Now I have 3 kids. Yeah, she's 10, she turned 10, he turned 7, and she's gonna be 5 this year. So this is Korean traditional costume, hanbok. So my parents-in-law brought them for New Year's, the tradition. Yeah, so I'm very busy working mom. So that was my brief introduction. So let's talk about some drug information. So why do you think we need to know about patients' medication when you treat patients?
Actions.
Actions?
Reactions.
Reactions? Okay. What else? Yes?
Because some of them take a bunch of medicines and they interact.
Yeah, so interaction. Yeah. And then, so you are doing dental treatment, right?
And
And
you have, sometimes you're doing invasive treatments.
Yes.
Cause more harm to the patient. So like antibiotics are taken.
yeah, so you need to think about maybe possible antibiotic, medication, or let me show you this. You will see this kind of patient. If patients are really young, then they will say no to every health history questionnaire, but sometimes they will bring a bag of medication. So you need to know about the medication information to provide them a safe dental treatment, right? Because some medication might have risk of bleeding, right? Infection, and then they might interact with epinephrine. So you need to think about limiting dose of vasoconstrictor, and then some of the medication can alter patient's blood pressure. So you need to think about some treatment modification they might need. Okay, so student talk about interaction. Okay, I'm not going to go to that details, but for example, if patient's already taking pain medication, okay, but what if you need maybe stronger medication, right? So you need to think about some possible interaction, and some of them can cause bleeding. We already talked about it. So that's why we need to know about drug information, okay? And especially some medications that can cause some oral changes, okay? They can cause candida infection. Some seizure medication, phenytoin, they are known for gingival hyperplasia cause, okay? So you need to think about it. And quite many medication can cause dry mouth. So dry mouth, if they have dry mouth, they are more prone to having decays. So you need to think about it, and you can provide more like oral hygiene instruction, and then more frequent recalls, so that they can prevent possible rampant caries from dry mouth. So that's why we need to know that information. So how to find it? Okay. We used to have this kind of book. Okay. I mean, we still have this book, but I don't think, yeah, someone is using or carrying, right? And this is physician's desk reference book, so PDR, you know. So it all has drug information, okay? But isn't it too heavy to carry it, right? So, and this one needs to be updated pretty much regularly, right? So you need to buy, you know, maybe new updated one. So that might be hassle. So where is the So we have the website. We have the website that we can use. Actually, school pays for you. So as long as you're here, you can use it. It's free item. Okay. So that's LexiComp. Okay, Lexi.com. So very specific for dental professionals. Good thing is it has the area that, you know, effect on dental treatment. Okay, effect on bleeding. So you can specifically search those information. Okay, so you don't need to carry the book. Okay, you can find this under links. Okay, I will show you how to do it under Lexi.com. But Axium, when you are in the clinic, it's on the underwear links. And I really want you to remember this, so that whenever you use it, you just go there and then find the access.
So that might be a nice quiz question.
Yeah.
If I asked you, where do you find
Uh-huh.
Alexa?
Yeah.
Pay attention.
Yes, so links under patient assessment, and then if you click patient assessment, you will see this screen, and there's a LexiComp. You can even search, but you will see this from LexiComp right there. Okay? And if you are on campus but not in the clinic, if you want to use your computer, okay, you can go to, you can try right now too, Lexi.com. So you can go to login, create account, okay? And there is a LexiComp online, right? LexiComp online. So this is super Wi-Fi system. So you don't actually have to enter password and ID. Yeah. So it's automatically on. You can leave it open because we are going to search some medication information. But this is just review how to log in. But if you are at home, and then if you want to use LexiComp, okay, then you can go to the same area, but it will ask you to enter password and ID. Okay, so that's the information that you're going to use. Okay, at home, so off campus. It's really good. Okay. It's only for current students, staff, or faculty member. So that's the LexiComp, right? So let's go back here. So right here, you are going to enter any drug the patient takes, right? Let's say a patient is taking Motrin, okay? Then you can click Motrin, and then you will see some category, and then just click, the closest one, okay? And if the patient is taking Metformin, you can click Metformin, search. Okay. Some Metformin has some combination of other drugs, okay? If it's just single metformin, you can click this one, or if it's combination of metformin and glycerides, then you can click that one. So you can search and click it. Okay. So I will come back to this one. So let's review. So you enter there. Okay. So let's say your patient is taking valium. Okay. So you're gonna put valium and search. Okay, and it will show valium, and you click this one. Okay, so it's going to show you this information. Okay, if it's open, you can do valium, and then you can see the screen. But it has a lot of information, but it has too much information for us. So we just wanna collect the data that we just want to know. Okay. So of course, we want to know the generic name and brand name, okay? And then the category, okay? So that one is for anticonvulsant. It's used for seizure, but a lot of patients is taking for maybe some anxiety, to reduce their anxiety, okay? So benzodiazepine, that's their pharmacology category, okay? So brand name, pharmacology category. And if you're not sure about spelling, no worries. Just just type it as you think, and then it will give you some options, and then you can search. I mean, you can find the one that you want. Okay, because I searched for valium, not 1L but 2L, and then I got this result. But don't worry, if misspelled, it will still give you the closest matches. Okay? And then just verify, oh yeah, that's the drug that I was looking for, just by looking at pharmacology category, because patient will say, I'm taking this medication for this. Okay? And then this is really important because specifically we want to know these. Okay? Local anesthetic vasoconstrictor precautions, okay? And then effects on dental treatment, and effects on bleeding, and adverse reaction. Under the adverse reaction, there will be a lot of category, but I really want to see anything related cardiovascular, but specifically with blood pressure and heart rate. Okay? So you don't necessarily write down vasodilation, but I want to see if it will cause hypertension or hypotension or tachycardia. What's tachycardia? Yeah, increased heart rate, bradycardia, okay? And arrhythmia, it's all irregular heartbeat because we use epinephrine, right? So we want to know the heart rate change. So those 6 are the one that I want to focus on under adverse reaction. Okay? Nausea, vomiting, very common. But in the SoAP, I want to see like anything related hypertension and heart rate.
When it says a 1% to 2%, is it saying
1 to 2% still,
right?
yeah.
Okay.
If it's less than 1%, I will probably ignore, but more than 1%, yeah. Okay. So remember these 4, very important, okay?
Where's the adverse reaction?
You need to probably go really, really down. You need to go
Their
here.
areas.
Yeah. We'll practice one medication together, and then I will show you, okay? Okay, so I talk about it, okay? It's blood pressure, pulse related adverse reaction. So when you make SoAPs, okay? SoAP. S, what is S? Subjective. O, objective. A, assessment. And P, plan. So any information from LexiComp, it should be going under subjective. Okay? Just memorize. Any lexical information is going under S, subjective, with patient's comment related. pertinent patient's comment. Let's say if your LexiComp said this drug will cause xerostomia, okay? Then what questions do you want to ask your patient? Okay. 200원 dental treatment was xerostomia. Yeah, like, do you feel like your mouth is dry? So you are going to ask them related questions. And then you can include the patient's comment under there. Okay? Patient denied dry mouth. Or patient said she sometimes feels her mouth is dry. Okay, some relevant information. Okay? But from LexiComp, you need to put brand name, generic name, pharmacology category. Okay? And then I already talked about this, right? Okay? And then this one is good too. So why patient is taking the medication? Okay? Patient is taking 10 milligram lisonopril for what? That's very important information. Why? Okay? So you are going to include that one under S. And objective is your observation, right? So that's your observation. So anything. So let's say anything you are going to see. Let's say this medication will cause hypertension. Okay? And you are going to take vital for patient that day, right? So you are going to write down blood pressure, today's blood pressure under O. Okay? But if medication doesn't have anything to do with hypertension, then you don't have to write it down. So any relevant, okay, pertinent with S, you are going to put it here. So dry mouth too. You are going to look at patient's mouth, and then you see, oh, there's a pooling of saliva, okay, on the floor of the mouth. Then you are going to just write it down. There's a pooling of saliva. Okay, that's your observation. So I'm giving you some examples. Okay, assessment. Assessment. Just remember any risk that patient can have because of patient is taking this medication. So it's usually from the effect on dental treatment or effect on bleeding from LexiComp information. Let's say this medication is causing bleeding, okay? Then assessment should be patient is at risk for bleeding, prolonged bleeding, okay? And phenytoin, it can cause gingival hyperplasia. Then you are gonna write down patient is at risk for this, okay? And some medication, I went over one medication with dental student last week. It was mycophenolate, that's for myasthenia gravis medication, but it had tons of dental-related side effects: ulceration, xerostomia, gingival hyperplasia, bleeding, and tons of risks. So you need to just write it down. You know, patient is at risk for this. So plan. So if you put any risk, I want to see the plan for each risk. Okay. So if you have two risks, gingival hyperplasia and tachycardia, then your plan should be related to those two risks, right? So gingival hyperplasia, what's going to be your plan? Maybe you can ask physician, okay, if they can switch medication. I mean, if they already have hyperplasia, right? Or let's say the risk is there, but you don't see any hyperplasia yet.
You ask the patient to watch their mouth.
Yeah. I mean, you are going to monitor, right? So you can say monitor for gingival hyperplasia. Okay? You can even recommend frequent recall, okay, oral hygiene. So I want you to write down any plan, related plan about the risk. How about tachycardia? That drug has risk for tachycardia. Then what's going to be your plan at the dental chair?
Cardiac arrest.
Monitor, vital sign.
Reduce vasoconstrictors.
Yeah, probably reduce, vasoconstrictor. Okay? So any related plan, you need to write it down. Okay? So for example, the valium, okay? Pharmacology category, why patient is taking for. This is just example soap, why patient is taking for. And then the effect on dental treatment was xerostomia. So you asked, okay? And then patient said, oh, my mouth is dry, regular basis, okay? But interesting thing is, your observation might be a little different. Even though patient says, I think I have, dry mouth. But when you look at it, pulling of saliva, that's okay. You can just write it down. But still, patient is at risk for xerostomia and hypotension right here, cardiovascular impact, hypotension. Okay? So for this assessment, related plan, for xerostomia, you're going to monitor saliva flow and then recommend biotin if necessary, right? And then for hypotension, you're going to monitor blood pressure. Question?
The EDC. The
Oh,
allergies
good.
treatment.
EDT, that's effect on dental treatment.
What is it?
Effect on dental treatment.
Okay.
And EOB, effect on bleeding. Okay? Effect on dental treatment, effect on bleeding. CV, cardiovascular effect. So you can just put CV. Okay. So
One of the things I wanted to make a comment on for the plan, it should never say none. There is always a plan of some sort for a patient on a drug.
because patient is going to be at risk for something. So don't put none. Okay. Another example, nifedipine. Okay, that's calcium channel blocker, but it's pretty common drug too. Okay, patient is taking it for angina. Okay, LexiComp said no local anesthetic precautions, no information on bleeding to require precaution. The major thing was gingival hyperplasia. Okay, and it can appear after 1 to 9 months, and patient said only been 3 months. Okay, but objective, your observation again. Okay. So main thing that you were worried about was gingival hyperplasia, right? So your observation under objective, I didn't see it. So no enlargement of gingiva. But assessment, right now, patient seems okay. Okay? Patient does not appear to have gingival hyperplasia, but patient still, at risk. So you can say, instead of the sentence, you can say, however, patient is at risk of gingival hyperplasia. So plan, monitor, okay? Or recommend frequent checkup so that you can check this patient more often. Okay? So I know we don't have enough time, but let's practice. Okay, I want you to find the information Metformin under LexiComp right now. Okay. So I will give you a couple minutes. I gave you this information. Patient is taking it 500 milligrams once a day. For his diabetes type 2. Okay? So I want you can go to lexi.com. I want you to search that one that I talk about. Okay? So can you open maybe your Word file or empty PowerPoint? You can just start to soap it up. SOAP. I have another practice, but I want you to do it at home because we don't have enough time. That's for lisonopril, another common drug. Okay. So try to write down, open your Word document, and then try to soap it up. If you don't practice, it's hard. Okay? But if you practice, it's going to be much easier when you go up cleaning. Okay? And then another recommendation, don't spend time on doing soaps in your dental chair. Okay? these can be done at home. Most of the LexiComp part, you can do it at home.
Can you go back to the SOAP?
Oh, yeah,
page
sure.
so they can see it? There you go.
Maybe this one,
Yes.
maybe some example.
Yeah.
Yeah. Mhm, thank you. So right now, metformin 500 milligram for diabetes type 2. Okay. I know the LexiComp information is pretty long, but you need to find the title about effect on dental treatment, effect on local anesthetic, vasoconstrictor, effect on bleeding.
Just copy and paste.
Yeah, you probably need to go scroll down.
That's a dental section. Just for dentistry. No, it's like, go down 2 bullets. There's adverse reactions. That's all.
So when you find your drug, you need to scroll all the way kind of to the bottom looking for the effect on dental treatment, the local anesthetic, the bleeding. It's all towards the bottom.
Wait, after you put the drug?
There's like a notification tree on the left. If you scroll down, it says double check.
It's bolded, right?
Yeah.
Yeah, it's bolded, so you should be able to see it.
There's also like a navigation tree on the left hand side.
Yeah, on the left side,
You
yeah.
scroll down and click
Yes.
dental information.
Yeah.
Just the one.
So very yeah, with this format. Metformin is what kind of drug the patient is taking this for diabetes type 1 and then dose information. So that's related to our dental treatment. Okay. So we usually use this format.
So if they're taking like
No, don't worry about those little details.
Our assessment only applies to dental treatment, right? Okay.
So focus on that information and then you determine if it said, okay, it has effect on dental treatment or what, okay? And then assessment will be the risk. So far, which risk do you have for this medication?
Stress-induced
Taste
hyperglycemia.
disorder.
And taste disorder, okay? Okay, I hope you already saw this information. So the first part of LexiComp, it gives you information brand name, generic name, and then the category. Okay? So metformin was anti-diabetic agent. So you are going to include that one. And then this one, more than related. So as you found, taste disorder, right? Taste disorder is one of the risks. And then stress-induced hypoglycemia. That was two major ones. Okay? And luckily, no bleeding effect, no vasoconstrictor precaution. Okay? So you need to think about those two: taste disorder and stress-induced hypoglycemia. How about adverse reaction, the cardiovascular? Oh, it's not showing my bottom. Maybe nothing, right? Yeah. So no cardiovascular information. So subjective. So I already talked about it, right? So this one we all look at it from LexiComp. So any information you want to ask to patient related to taste disorder, and stress-induced hypoglycemia. Do you want to ask more questions about that to your patient?
I have a question.
Yeah.
So when we choose the brand name, it's the one the patient has, right?
Yeah. Usually, yes.
So I just created a homework assignment worth 10 points, an SOAP for metformin, and an SOAP for
Lisonopril.
lisonopril.
Lisonopril
Next
has
Monday at 8.
Lisonopril has more side effects. You will see. Okay, it has more long list. But based on this, you want to know about this. If patient has taste disorder, so you can ask, did you notice any taste change, right? And how about hypoglycemia attack? Stress-induced. Dental treatment can be very stressful, right? So you can ask patient, are you nervous about dental treatment? Okay. Because you can determine, patient has stress in dental chair or not, right? Then if patient said, I'm very nervous, then it can cause stress. That means it can cause hypoglycemia in your chair, right? So you want to ask about some stress level, and then have you ever had hypoglycemia, recently, or how often do you have it? So patient said, I gave you more patient information. Patient said, I have hypoglycemia once in a while, so I always carry, candies. Okay. Are you stressed about dental treatment? No, I'm not. Any taste disorder? No. That's your subjective information, right? How about objective information? What do you see regarding taste disorder and hypoglycemia right now? I mean, taste disorder, you cannot really observe, right? So you can say none. Observation can be none. Okay? That's fine. But risk, we already talked about the risk, these two risks. So your plan, what's your plan?
Morning appointment.
The morning appointment is one of the stress reduction protocol, right? But related to hypoglycemia. So that's good. Yeah, make sure patient eats. Yeah.
Also have a sugar source available.
Yes. And clinic supply has juice. Okay. So have sugar source available. And for taste disorder, you can monitor, or you can have patient report if they have any taste change. Okay. So that's your plan. I mean, this is my key, but I want you to practice, okay? And then Mrs. Lee can post the key later, right?
I will. I have it
Yeah.
already loaded.
Yeah.
I'll post it after they send it their homework.
Okay, good. And lisonopril, same. I'm not going to show you the key right now. We are running out of time, but you can practice, and then she can post the key. Okay? So remaining, but it's going to be a little long. The lisonopril has more problem. Okay? Okay, let me talk about. Oh, and where do you put the soap? you know, under the page one, there is an area that you can put medication information, but we don't really want to put soap over here. That's just brief information. Okay? So specify medication, dosage, and frequency and reason. Here, we just want the medication name, brief information, but not the soap. Because let's say if your patient is taking 10 medication, you don't want to put all the soaps right here. Rather than that, you want to put that medication's information under related medical condition. Okay? So for example, hypothyroidism, okay? You can, are they required to make medical condition soap too? Okay, then you can just put brief information about hypothyroidism, right? And then under that, you are going to put related medication soap so that they can be tied together, okay? Hypertension, you're going to maybe say patient has hypertension, right? And then in that same box, hypertension medication. If they take 2 medication, you can put it over there so that we can see this medication is for that medical condition. Okay? Yeah.
What if they're taking a supplement, like a dietary supplement, like a vitamin?
It's you can just mention it right there. But we don't usually soak, you know, vitamin D. Yeah. There's omega 3. We don't usually soak it up. But you can just put that information right there.
Or like something for like heart health, baby aspirin or something for like just
Baby
as a
aspirin,
precaution.
they might say, oh, it's just for prevention of my heart disease. If you cannot find any related medical condition, maybe you can soak just 1 or 2 medication right there. Okay? Yes.
What if they're taking an oral contraceptive and you've never like seen the name,
The name
or
or-
it
yeah.
will just pop up?
There is a pregnancy-related question too, but that's fine. That medication soap can be here. So we want to limit the amount of soap right here. But if you cannot find any specific medical condition, you can soak it up here.
But on that particular one, I would soak it with the pregnancy.
Yeah.
Are you pregnant? Know what I'm taking this.
Yeah. Okay. Because some you know contraceptives they can interfere with some antibiotic medication too. So we want to soak it up. Okay. But under pregnancy, it's good.
Like IUDs and other like contraceptive stuff. Do we soak those as well? Like because I put it in like
That's more device, right?
Yeah.
Yeah, then usually no. Yeah, because medication. You're talking about medication. So you can just briefly say patient is this, but you don't have to stop. Yeah. Okay. So I'm gonna talk about oral pathology consultation really quick. So these are people that you are gonna see when you ask oral path consultation. Okay?
I have a question.
Yes.
Instead of starting here, would you be willing to come back and do just a small section on this
Oh,
tomorrow
okay.
and next week Monday
Sure.
instead of cramming it
Yeah.
in 5 minutes?
I know. Yeah.
Is
Yeah,
that
that's
better?
fine. Yeah,
Is that okay for you?
Yeah, I wanna take more time.
Yes. Because I think oral path is going to take
Yeah.
much longer.
I have some, example soaps.
Is
But
that good?
yeah, that's okay. But before I finish, I skip one part because I thought I'm running out of time. So I want to just show you how to find the possible interaction with the drug under LexiComp. Okay. So let's say if patient is taking this medication, okay. If patient is taking this medication, and then patient reported, I have allergy for ampicillin. But the thing is now, you want to prescribe antibiotics. Then you probably want to know you want to pick the safe antibiotics which doesn't have any interaction with those drugs that patient is already taking, right? So LexiComp, you can have that information. Okay, so let me show you. Okay, so let me go back to LexiComp, the main one. Okay. But instead of searching the regular medication right there, but let's go to alert and interaction. Okay. Do you see alert interaction right there?
Interactions, yes.
Yeah, okay. So right now, search drugs. So I'm going to put the medication's name that patient is currently taking. So let's say patient is taking Allegra, maybe Allegra D 12-hour. Patient is taking that medication right now. And patient is also taking maybe Vasotac. And let's say patient is also taking, which medication did I use? Sorry. Oh, the digoxin. Okay. The patient is taking this. So patient is currently taking these 3 medications, and patient reported, oh, I'm allergic to ampicillin. So I'm going to put search allergy ampicillin, okay, and then search, okay. So now let's say you wanna prescribe antibiotics because patient has some oral infection, okay. Then you're gonna go to medication category right here, medication category. Yeah, and medication category, and then I'm going to say antibiotics, odontogenic infection, okay, odontogenic infection, okay. So that's the one that you are going to prescribe, okay, and then now you are going to click analyze. Okay. Then it will give you some information. So LexiComp interaction analysis. So if you have the green here, then that's a safe drug. Okay. But this X, it says avoid combination. So you don't wanna prescribe amoxicillin. Okay. Because patient was allergic to ampicillin. Okay. But this one, monitor therapy. So you can still use it. Okay, but you can monitor. So it's going to give you the information which antibiotic is safe. So that's the another LexiComp usage that you can use later in the future. Okay? Yeah. So that's one thing I wanted to show you. Do you have any question about medication? So patient or not? Yes.
I mean, she's taking fair control, but she doesn't know the name of it, or something else, but she doesn't know that.
That's a question because we have those patients. So you can ask them.
Can you use it? What she's saying, what if they're taking a medication like a emergency room, but they don't remember the name of it? So she's going to tell you how to find it.
Yeah, so I mean, it needs to be from patient, right? So you can say, please, I mean, when you go home, you can find maybe the medication name from your prescription or something, but can you bring it for next time? Can you bring it next time so that we can update your medical history chart? Or if they cannot find it, you need to contact their physician's office.
Sometimes you can search.
You can,
and then if you kind of give us
give some names. Yeah.
So how do you do that?
Here, it's really hard. Let's see. You probably need to. So usually, it doesn't really give that information. If
Sometimes you can do it about fast.
yeah. Let's try this one. So I usually ask patients, because if you don't know name, it's really hard to. If they know, like kinda remember the name, then you can kinda like search, and they will give you the closest one. But if they don't have any idea, then yeah, it's really hard. It's really hard. But ask them just to bring the information next time, or contact physician. That's Yes.
If we have a new patient and they bring in their medication list, we have to soak that before we treat them, correct?
It's safe, yeah. It's safe to soak them up before you start any dental treatment. Because if you're going to do SRP, a patient has some bleeding risk, you want to know before that, right?
Yeah.
That's a good question, AJ. So if you're updating your medical history and you need to soak up a bunch of medications, we can have Fuller soak up for you while you're continuing to do your data.
Got it.
So that's where you're gonna help each other.
Yes.
Can we do that before?
Yeah, you can if you know the medications. If you happen to be bringing in somebody that you know, you can ask them ahead of time, do you know, are you taking any drugs, medications, or supplements? And I always ask drugs, medication, supplements. Because if they're taking something over the counter, like aspirin, they won't list it. Or if they're taking ginkgo or garlic or ginger as a supplement, all three of those, anything with a G often causes bleeding. So if you're taking that plus an aspirin, that's a key for you. So I always say drugs, medications, or supplements.
So if I come back for oral pathology, so if you have any more questions about medication, I can answer.
Perfect. Does that work for next week?
Yes.
So the assignment is going to be due on Monday, May 8th. But she will answer any questions that you have. Again, I'm not looking for perfect answers, but I'm looking that you attempted it, tried it, and that you were able to at least go into Lexi online and look at, and just get familiar with being able to do it, because you're going to have to start doing it. I'm going to send out an email to the faculty and let them know that you had this lecture, so beginning Wednesday, you'll be able to start medication.
What's the afternoon?
Thank you, Dr. Kim.
Oh, no problem. No problem. I will see them next week.
Yeah, we have to go
Really quiet, but we can
Yeah, we have lady was on Dr. She said that we all have to go to Calgary into a single room in a 2-room. I know we're free, but I have high likelihood of getting it.
So we can make one chapter, another chapter Friday. But you should all have
Okay. Yeah, she told me that I opened up at midnight last night. Right now it only shows like it's just the mail. Like you can't change it. But it still doesn't show up on my, so I don't know. Huh? How did you get her to be more lenient for you? Why was she not free? Okay, no, I went to the okay, I went to talk to her and the girl. So I went towards the desk with the girls. I was like, hi, Brian, is there and then I looked over and she's like, no, she's something but like, do you just have a question? I was like, I just have questions about housing. She's like, oh, well, I take care of all the housing. She's like, well, and I went to like talk and I literally just like couldn't. And so I was like, can you go in here? And we went to Mr. Nathan's office and she closed.